Jumping out of bed too quickly, risks and solutions. 1. Risks of jumping out of bed too quickly. Jumping out of bed too quickly after waking up may seem like a normal action, but for older people, this can be the cause of many serious health problems. Here are some of the main risks. A. Orthostatic hypotension. When you lie down for a long time, blood tends to accumulate in the lower part of the body. If you stand up too quickly, your circulatory system has not had time to adjust, leading to a sudden drop in blood pressure. This can cause dizziness, lightheadedness, or even fainting, increasing the risk of serious falls. B. Dizziness and loss of balance. When you change position suddenly, your brain may not receive enough oxygen for the first few seconds, causing dizziness or disorientation. This is especially dangerous if the elderly are in a narrow space or have many obstacles, which can easily lead to falls and injuries. C. Risk of falls and injuries. The elderly have weaker bones and joints, and if they fall, they can break their hips, break their arms, or suffer traumatic brain injuries, seriously affecting their quality of life. According to statistics, falls are one of the leading causes of death from injuries in the elderly. 2. How to overcome. How to wake up safely. To avoid the above risks, the elderly should apply the following measures. A. Wake up slowly and step by step. When you first wake up, lie still for a while, close your eyes, take a deep breath, and gently move your fingers and toes. Then, slowly lean to one side and lean on your hands to support your body. Sit up slowly in bed, put your feet on the floor but do not stand immediately. Wait about 30 seconds to 1 minute for your body to adapt before slowly standing up. B. Warm up gently before getting out of bed. While still in bed, do some light warm-up movements such as rotate your wrists and ankles. Bend your knees and pull them gently towards your chest to stretch your muscles. Gently rotate your hips to help improve blood circulation. These movements help your body get ready to stand up, reducing the risk of losing balance. Use support when standing up. When getting out of bed, you can use your hands to hold onto the edge of the bed, chair, or table to ensure stability. If you often have problems with balance, you can consider using a walking stick or installing handrails near the bed. D. Adjust your sitting and standing posture. When sitting in bed, keep your back straight and place both feet on the ground. When standing up, do it slowly, putting your weight evenly on both feet to avoid swaying. If you feel dizzy, sit down immediately and rest until you feel stable. 3. Some important notes. Check your blood pressure regularly. If you often feel dizzy when standing up, measure your blood pressure in the morning and consult your doctor if there are any unusual signs. Replenish enough water. Dehydration can lower blood pressure, so drink a glass of water right after waking up to help blood circulation work better. Pay attention to the light. Make sure there is enough light in the bedroom in the morning to avoid getting disoriented when getting out of bed. Maintain a reasonable diet and exercise. Eating a nutritious diet and exercising regularly helps improve circulation, reducing the risk of orthostatic hypotension. Number 4. Conclusion. Jumping out of bed too quickly can have many dangerous consequences, especially for the elderly. However, by simply changing some small habits, such as waking up slowly, warming up gently, and maintaining good balance, we can significantly reduce the risk of falling and related health problems. Practice this habit every day for a safe and healthy morning. Not drinking water after a long night's sleep, risks and solutions. 1. Risks of not drinking water after waking up. After a long night, the body loses water through breathing and sweating. If not replenished promptly, dehydration can cause many serious health problems, especially in the elderly. Here are some of the main risks. A. Dizziness, fatigue, and memory loss. When the body is dehydrated, blood circulation decreases, leading to less effective oxygen supply to the brain. This can cause dizziness, loss of concentration, and even memory loss if dehydration persists. B. Effects on blood pressure and cardiovascular system. Dehydration makes the blood thicker, increasing the risk of high blood pressure and irregular heartbeat. For the elderly or those with a history of heart disease, dehydration in the morning can increase the risk of stroke and heart attack. C. Impaired kidney function. The kidneys work continuously to filter toxins from the body, but without enough water, this process will be affected. Over time, not providing enough water in the morning can increase the risk of kidney stones and kidney failure. D. Affects the digestive system. Lack of water causes gastric juice to thicken, increasing the risk of constipation and indigestion. Some cases may experience acid reflux because the stomach does not have enough water to neutralize the acid. 2. How to fix. Drink water properly in the morning. To protect their health, the elderly should maintain the habit of drinking water right after waking up. However, you need to pay attention to how to drink water most effectively. Drink a glass of water as soon as you wake up. A glass of filtered water, about 250 to 300 milliliters, will help replenish the amount of water lost during the night and stimulate the circulatory system to work more smoothly. This also helps eliminate toxins, supporting liver and kidney function. B. Avoid drinking water that is too cold. Water that is too cold can cause strong stimulation to the stomach and sudden constriction of blood vessels, which is not good for cardiovascular health. Instead, warm water or water at room temperature is the ideal choice. C. You can add lemon or honey. A few drops of lemon juice help the body detoxify and aid digestion. Honey helps increase energy gently and is good for the immune system. D. Do not replace filtered water with coffee or tea. Coffee and tea have a diuretic effect, causing the body to lose more water instead of replenishing water. If you want to drink tea or coffee, wait at least 30 minutes after drinking water. E. Maintain a regular water drinking habit throughout the day. Not only in the morning, but throughout the day, the elderly need to drink enough water to maintain body functions. Divide the amount of water you drink instead of drinking a lot at once to avoid putting pressure on the kidneys. 3. Conclusion. Not providing water after a long night's sleep can lead to many serious health problems, especially in the elderly. Adding a glass of water as soon as you wake up is a simple habit but brings many great benefits. Form the habit of drinking water regularly every morning to ensure a healthy and energetic body. 3. Skipping breakfast or eating unhealthy. Dangers of skipping breakfast or eating unhealthy. Breakfast is considered the most important meal of the day, providing energy to start a new day effectively. However, many people often have the habit of skipping breakfast or choosing unhealthy foods, leading to many negative impacts on health, reduced energy levels, and work performance. When not eating breakfast, the body is not provided with enough glucose, the main source of energy for the brain, causing fatigue, lack of concentration, and reduced work productivity. Affects the digestive system. The stomach continuously secretes acid to digest food. If you skip breakfast, this amount of acid is not neutralized, which can cause stomach ulcers or digestive disorders. Blood sugar disorders. Not eating breakfast or eating foods high in sugar can cause sudden increases or decreases in blood sugar, causing symptoms such as dizziness, nausea, and feeling hungry quickly. Increased risk of obesity. When skipping breakfast, the body is prone to hunger in the middle of the day, leading to snacking or consuming more food in the next meals, causing uncontrolled weight gain. Affects the cardiovascular system. Many studies have shown that skipping breakfast may be associated with a higher risk of cardiovascular disease due to lipid metabolism disorders and increased blood pressure. Solutions to maintain a healthy breakfast. Instead of skipping breakfast or eating unhealthy foods, you should build a balanced breakfast that ensures adequate provision of necessary nutrients. Eat a full breakfast with protein, fiber, and healthy fats. These foods help maintain stable blood sugar levels, provide long-lasting energy, and are good for the digestive system. Some ideal choices include oats, rich in fiber, help with digestion and maintain a feeling of fullness for a long time. Eggs, provide high-quality protein, help maintain muscle and increase metabolism. Fruits, provide vitamins, minerals, and fiber to improve overall health. Limit processed foods and foods high in sugar. Cakes, carbonated soft drinks, fast food can cause a sudden increase in blood sugar and cause fatigue afterwards. Drink enough water or add healthy drinks. A glass of warm water, green tea, or nut milk in the morning can help stimulate the digestive system and provide better energy. Maintain a regular breakfast habit. Make a habit of eating breakfast regularly at a certain time to stabilize metabolism and support digestion. Conclusion. Breakfast plays an important role in overall health. Skipping breakfast or eating unhealthy foods can cause many health problems such as fatigue, blood sugar disorders, digestive and cardiovascular effects. To maintain a healthy body, Choose nutritious foods such as oats, eggs, fruits, and maintain a regular breakfast habit. 4. Rushing to complete morning tasks. The dangers of rushing in the morning. Many people have the habit of trying to complete everything quickly in the morning to get to work or school on time. However, rushing can cause many risks and affect health. Accidents are more likely to occur. Rushing out of the house, slipping in the bathroom, or dressing hastily can lead to injuries such as tripping or spraining an ankle. Increased stress and anxiety. A rushed morning can increase stress levels, negatively affecting your mood and productivity during the day. Impacts cardiovascular health. Morning stress can increase blood pressure and affect heart rate, especially for people with a history of cardiovascular disease. Missing good habits. Rushing can cause you to skip healthy habits such as eating a full breakfast, exercising lightly, or practicing mindfulness to start the day positively. Solutions to avoid rushing in the morning. Instead of rushing, you can apply the following solutions to create a relaxing and effective morning. Prepare the night before. Prepare your clothes, documents, bags, or breakfast in the evening to save time the next morning. Wake up earlier. Spending an extra 10 to 15 minutes in the morning can help you not to rush and have time to practice good habits. Create a quiet and tidy environment. Arranging your living space neatly makes it easier to find necessary items and reduces stress when preparing for the morning. Practice slow and conscious habits. Take time to enjoy breakfast, do some stretching, or meditate to start the day calmly. Conclusion. Rushing in the morning not only causes the risk of accidents, but also negatively affects your health and spirit. To have a productive and safe workday, take enough time to prepare, create a relaxing morning routine, and maintain a clean, quiet environment. 5. Not wearing the right footwear. Dangers of wearing the wrong footwear. Footwear plays an important role in protecting your feet and maintaining balance when moving. Wearing the wrong footwear can cause many risks, increased risk of falling. Slippers or shoes that do not have good grip can make you more likely to slip, especially on slippery floors or uneven roads, cause foot pain and affect gait. Shoes that are too tight, too loose, or do not support the foot structure properly can cause pain and affect walking posture. Prone to injury. Shoes that are not sturdy enough can cause you to sprain or injure your ankle when moving quickly. Solution for choosing safe footwear. Choose footwear with good grip. Use non-slip shoes or sandals to reduce the risk of falling. Make sure the size fits. Shoes should not be too loose or too tight to avoid causing foot pain. Prioritize sturdy design. Choose shoes with sturdy soles that hug your feet to ensure safety when moving. 6. Skipping medication or taking medication incorrectly. Dangers of skipping medication or taking medication incorrectly. Forgetting to take medication or using medication incorrectly can cause many serious health consequences. Some common risks include reduced treatment effectiveness. When not following the correct regimen, the medication may not achieve the desired effect, leading to prolonged or more severe illness. Unwanted side effects. Taking an overdose or taking medication at the wrong time can cause side effects, weaken the body, and even threaten life. Increased risk of drug resistance. For antibiotics or drugs used to treat chronic diseases, incorrect use can reduce the effectiveness of the drug, causing bacteria or viruses to become resistant to the drug, making treatment difficult later. Risk of health complications. Some drugs need to be taken in the correct dose and on time to maintain stability in the blood. Failure to comply can lead to serious complications such as high blood pressure, uncontrolled diabetes, or recurrence of cardiovascular disease. Reasons why patients stop taking medication or take it wrong. There are many reasons for this condition, including forgetting to take medication, especially for the elderly or those who have too many medications to take every day. Misunderstanding the instructions. Some patients do not read carefully or do not understand the instructions for using the medication. Fear of side effects. Some people stop taking medication due to concerns about side effects without consulting a doctor. Subjective about the disease. When feeling better, many people stop taking medication without following instructions. High treatment costs. Expensive medication prices can cause patients to reduce their dosage to save money. Solutions to ensure correct medication. To avoid unwanted consequences, you can apply some of the following solutions. Use a pill box. Divide the medication by day or by session to help you easily track and not miss doses. Set reminders. Use your phone or alarm clock to remind you when to take your medication. Ask relatives for help. For the elderly or patients with poor memory, you can ask relatives to help manage your medication schedule. Write a medication schedule. Note specific times, dosages, and how to use them for easy control. Ask your doctor when needed. If you have questions about side effects or how to use the medication, consult your doctor instead of changing the regimen on your own. Store medication properly. Read the storage instructions carefully so that the medication does not lose its effectiveness due to temperature or light. Conclusion: taking medication correctly and in the right dose is very important in the treatment process. To ensure your health, follow your doctor's instructions, use memory aids, and do not change your medication regimen on your own. A proper medication regimen will help you improve your health and avoid unfortunate risks. 7. Overtraining. Dangers of overtraining exercise is an important part of a healthy lifestyle, but overtraining or exercising incorrectly can be harmful to your body. Some common risks include muscle strain and injury. Overtraining can damage muscles, causing long-term pain and increasing the risk of muscle tears or tendinitis. Joint damage. Poor form or overtraining can damage joint cartilage, leading to arthritis or chronic joint pain. Strain on the heart. Excessive exercise, especially in people with cardiovascular problems, can cause irregular heartbeats or even strokes. Fatigue and fatigue. Overtraining without adequate recovery time can lead to fatigue, insomnia, and decreased work performance. Solutions for safe exercise. To ensure effective exercise without harming your health, apply the following measures. Warm up and stretch properly. Before exercising, spend at least 5 to 10 minutes to warm up gently and stretch your muscles. Exercise moderately. Choose exercises that are suitable for your physical condition. Increase the intensity gradually instead of exercising heavily from the beginning. Rest properly. Make sure your body has time to recover between workouts. Avoid exercising continuously without resting. Drink enough water. Maintain enough water in the body to avoid dehydration and cramps during exercise. Listen to your body. If you feel unusual pain or are too tired, reduce the intensity of your exercise or rest. Incorporate gentle exercises. Yoga, breathing exercises, and light walking can help improve your health without putting too much pressure on your body. Conclusion: physical activity is essential to maintaining good health, but it needs to be done correctly and with a plan to avoid risks. Listening to your body, exercising moderately, and incorporating stretching will help you maintain your fitness without harming your health.